Thanks, Senator White. Senator Roberts, then Senator. And I'll go to Senator Brockman, sorry.
Thank you, Chair, and thank you all for being here. Now, we specifically requested Dr. Kate Manderson be here. She's not.
I didn't receive that advice. Apology, Senator.
Who would be her direct supervisor?
So it's not her direct supervisor, but Mr. Marcellier is supervisor.
Medical. Covers the medical side of things?
Yes, that's correct.
Okay, thank you. Does Dr. Manderson's role as Principal Medical Officer for CASA have her full attention?
I'm sorry, Senator, what?
Does Dr. Manderson's role as Principal Medical Officer for CASA have her full attention?
She's dedicated to the role, absolutely.
Well, the reason I ask is because I understand that in 2020 she was, quoting from her Twitter, a chair of 2 boards, a director for 3 more, owned 4 medical practices and a COVID clinic, among many other pursuits. What's her current status in terms of chair and directorships of other boards?
Senator, I would get the detail on notice. I do know that she is involved in
You're quite busy.
some other aspects, but she's absolutely dedicated to CASA, and we're very satisfied with the time we get from her.
Could you also find out, please, on notice, does she still own and operate the 4 medical practices and the COVID clinic?
My understanding is that she has an interest in some medical practices, but doesn't actively work in those.
Does she administer, or does she supervise people or employ people who administer COVID injections through those medical practices and COVID clinic?
Senator, I'd have to get the detail for you on notice.
If the answer is yes, then she's received money from the government.
Senator,
for doing
as
so.
Mr. Marcellier said, we'll take that on notice.
Right. Well, the question is, if she has received money from the government or her businesses received money from the government, has she declared that conflict of interest?
So, Senator, Dr. Manderson, when she joined CASA, went through the normal conflict of interest declaration processes that we have, and we have in place arrangements to manage those potential conflicts. 2021,
I think it was,
we'll take that on notice.
Okay,
So Senator, one of the important elements to note is that it's a requirement for medical practitioners to maintain some medical practice. So our doctors do typically have an involvement in the medical profession, and that's a requirement of them being able to maintain their
Just the
certification.
level of involvement and whether or not there's money from the government.
Sure.
They're 2 important questions.
So there's no... Well, we'll take it on notice.
We'll take it on notice, thanks, Senator.
I turn, before I get to something else that's happening in the United States, and ask you whether it's happening here with regard to medicals. Are you aware, my office sent you this paper?
Yes, Senator.
Okay. Are you aware, you would have seen a copy of the adverse events and deaths attributed to various vaccines in the history, the last 14 vaccines that have been withdrawn?
Senator, as I think we went through in some detail at our last hearings, we've got no evidence in Australia to suggest any issues associated with vaccinations in Australia.
No, and that's what bothers me, because you also, I repeatedly asked you, Mr. Machea, that on whose advice did CASA allow the airlines to mandate injections? And I only could get back the experts.
So, Senator, I think we went through last time, we didn't have any involvement in the mandates, and that was a matter between airlines and the medical authorities in Australia.
Why did you allow the mandates?
It's not a matter for us. We have no view on it, one way or the other. It's a matter between airlines.
Let's see why I think it is a matter,
Yeah.
and ask you questions about this. That paper that you received was written by 7 medical people, professionals. Dr. Philip Altman has got 40 years working with the TGA as a consultant and with Big Pharma. He worked for Big Pharma under contract. James Rowe, similarly, 40 years professional experience, including manufacturing practices. Wendy Hoy, one of Australia's most esteemed medical professors, plus 4 others. They document how alarmed they are at the fact that the COVID injections bypassed normal testing procedures in the United States. They did not get tested in this country. Are you aware of that?
So, Senator, our interest is aviation safety, and as Ms Spence said, we have seen nothing about COVID vaccinations that would cause us any concern about aviation safety. The matters you're talking about are not matters for CASA, they are matters for health authorities, and we do not get involved in those matters.
So let's turn to pilots. Because a lot of pilots are now complaining, and in America, a number of pilots, 1,000 at Southwest Airlines, I've been told by law in America, have been stood down for medical reasons because they cannot pass their medical examinations to continue as a pilot.
Senator, we're not seeing the same in Australia.
On that, Nelson?
Sorry?
We're not seeing the same in Australia, Senator.
Okay, well, that's not what some pilots are telling us. So let's have a look at the... I understand that the Designated Aviation Medical Examiner's Handbook contains a limit specified by CASA for systolic and diastolic blood pressures and EKG parameters. The United States FAA has recently changed their acceptable limits in terms of EKG parameters. Is CASA considering any changes to systolic, diastolic or EKG parameter limits?
Senator, we have parameters around heart conditions and heart health. We've made some good changes probably 6 months ago that have adopted a risk model that's developed in New Zealand around cardiac risk. I'm not aware of what the changes are that you're referring to in the United States.
So you're not aware on the basis of the FAA's change?
I'm not aware of what that change is, no.
So you haven't made...
We'll take that on notice, Senator, and review if there's anything in there for Australia that we need to act on as well.
So you haven't made any changes in the last 3 years?
We have made changes to cardiac risk assessment. As I mentioned, we've adopted a New Zealand-based risk model, which we think assesses cardiac risk much more effectively than what we've used before, and it involves some of the matters that you're talking about.
Does CASA recognise that severe cardiac conditions such as myocarditis and pericarditis are known adverse events attributed to COVID vaccines? Just a yes or no is sufficient.
So, Senator, we are aware that they are generally associated with patients that have had COVID or recovering from COVID, as well as vaccines, but it's a much more common condition for somebody that has had COVID from the data than from the vaccine.
These are now known to be associated with the COVID injections.
And with COVID too, Senator Roberts.
With COVID, yes, absolutely. Yeah.
Was CASA a participant in any consultation with the airlines before they enacted blanket vaccine mandates on their pilots?
No, Senator, as I said, we have no involvement in that and no interest in that.
Given significant adverse events and reactions are a potential outcome of COVID vaccination, why wasn't CASA consulted?
Senator,
Because these adverse events were actually stipulated by some of the manufacturers.
Senator, we've got no evidence of adverse effects in pilots in Australia. We have no reports of adverse effects from COVID vaccinations in Australia.
Can I just say, Senator Roberts, that you did touch on this last time, and Senator Antic has had a few questions today, and I think Senator Rennick. I don't know if Ms Spence can make it any more clearer that your line of question...
Let's change then, Chair.
Yeah, sure. Okay, thank you.
I'll go to a separate issue then. It relates to a pilot by the name of Matt Arnold. He discovered he had kidney stones in February 2022. He did the right thing and notified CASA. Matt had 6 rounds of laser surgery to remove the kidney stones, which was 3 more rounds than his urologist felt comfortable with recommending. The extra surgeries were completed to satisfy CASA's arbitrary ruling that there be absolutely no retained stones. At the end of the 6 surgeries, Matt still had some minor retained stones, which is common apparently. His urologist certified they were stable and extremely unlikely to pose any risk. The only way to completely remove the minor stones is by percutaneous nephrolithotomy surgery, considered so high risk that Matt's urologist refused to recommend it given the stability of the minor stones and the risk-benefit of the operation. Despite this, CASA refuses to reinstate Matt's Class 1 medical clearance, effectively ending his flying career. How can this be considered a reasonable reaction, and why is CASA refusing to respect the opinion of a qualified urologist?
So, Senator, I don't know the circumstances of the individual case you've talked about. What I can tell you is that we do consider kidney stones to be quite a serious safety-relevant condition, and the reason for that is that kidney stones can bring on very rapid onset of debilitating pain, and in flight you can imagine that would be quite a serious event. So while I don't know the details of the case you're talking about, that is a condition that we treat quite seriously.
Do you still maintain, as you did last Senate estimates, that there is no perverse incentive for pilots to not report medical conditions given CASA is unreasonable in their treatment of reports?
Senator, can I just make a point that we process around 25,000 medical applications every year. We refuse 100. So I think it's important to note that while you'll be able to find individual cases where there have been issues, and we can, I think we could talk through those in details, but I think the suggestion that we are unreasonable does not align with the statistics.
So I asked you, do you still maintain that there is no perverse incentive for pilots to not report medical conditions?
I still do maintain that,
Okay.
Senator.
Is it possible that there is a pilot flying in Australia right now with an entire kidney removed and you wouldn't know about it because their career would be at risk if they told you?
Of course that's possible, Senator.
Why are pilots prohibited from taking the weight loss drug Duramine or phentermine? They can't even fly after they stop taking it until they receive a medical clearance.
Senator, we publish clinical guidance on a number of medications. I don't know the detail of that specific medication, but there would be a safety relevant effect that would require that provision. If you'd like the detail, we can get the detail
Yes,
for you on
please.
notice.
Would that be tested in an aviation environment?
I don't know what you mean by tested.
Well, how do you assess the drugs?
Senator, we'll take that on notice.
So I'd like to know whether or not you've tested it in the aviation environment. How many reports of pericarditis and myocarditis have been made to CASA?
We'll take that on notice, Senator.
My understanding is that CASA, through its medical officers, can essentially override a medical examiner's conclusions or issues. Is this accurate?
Yes, Senator, we could if there was a concern with the outcome. But as I said, of the 25,000 applications that come into CASA every year, only 100 are refused. So I think it's important to keep that in mind when asking these questions.
Can you, in addition to that, could you tell me on notice what the cases were related to?
The 100 that were refused?
Yes, please.
We'll take that on notice, noting
Yep.
we'd have to maintain privacy considerations as well for the individuals.
Absolutely. Yep. Thank you, Chair.
All right, thanks, Senator Roberts. Now, Senator Brockman, you've been